Hey everybody, and welcome back to the channel, The Whiteboard Doctor. Today we're going to be talking about cardiac output and the Fick equation. Specifically, we're going to be talking about what the cardiac output is and then how to calculate it using the Fick equation. Within that, we'll talk about each part of the Fick equation to kind of get a good conceptual understanding of these different components and how they relate to the cardiac output. So to start with cardiac output is abbreviated CO, C for cardiac, O for output. How convenient. And in a normal person, the cardiac output is 4 to 8 liters per minute. What does this mean? It means that the heart pumps out 4 to 8 liters of blood every minute. All right, this is not to be confused with another measure we use called the cardiac index. The cardiac index is essentially the cardiac output, but as a function of body surface area. So it would look like this. A normal cardiac index is anywhere from 2.5 to 4.0 liters of blood per minute per metered squared. So the cardiac index can be helpful because it takes into account how big a person is, their body surface area, and then that can help you in understanding, what their cardiac function is when their, body habitus may, be discordant. And may then give you a more accurate determination of how well their heart is pumping. All right. When we talk about cardiac output, just quick, we tend to derive it as being equal to heart rate times stroke volume, right? And the normal stroke volume typically is 60 to 100 milliliters of blood per beat of the heart, right? And the normal heart rate tends to be 60 to 100 beats per minute. Okay, so that is kind of the equation that we all know and love. The issue, though, is that it's easy to determine heart rate. In the clinical setting, you can just check their pulse, listen to their heart, look at the monitor, look at telemetry. But it's much, much more difficult to, calculate or identify their stroke volume in the clinical setting. So when we're calculating cardiac output, we clinically can't really use this equation well. And that's where we get into the Fick equation. The Fick equation is a surrogate equation we use that takes different variables that we can actually get in the clinical setting to then calculate the cardiac output. Okay, what is the Fick equation? Well, to start with, the Fick equation goes cardiac output equals a constant on top, which tends to be 125 milliliters of oxygen per minute. Actually, no, we're going to go back even one step further. So cardiac output with the Fick equation essentially equals VO2. This is oxygen consumption divided by your SaO2, which is your arterial saturation of oxygen, minus your venous saturation of oxygen. All right, we'll expand this out further, times your hemoglobin, which is your blood count, times a constant of 13.4. So this is the equation we use. And in the clinical setting, this oxygen consumption, we tend to use 125, and I'll get into why, milliliters of oxygen per minute times the body surface area, with the caveat being that if you're above the age of 70 years old, you will instead use 110 milliliters of oxygen per minute. So what is this equation saying, and how did we get this equation? I think it's important to, understand conceptually how we got here, because then you'll be better able to understand when to use this equation, how it can go wrong, and what you need to use it. So a few things here. When we think about this equation, the way we first got this equation is actually coming back to the oxygen consumption equation. So what is oxygen consumption? That was this variable here, right? VO2. And this is oxygen consumption. I'm just going to do O2 consumption. And if we think about oxygen consumption, that is how much oxygen the body utilizes. So it would make sense then that the amount of oxygen the body utilizes is going to be proportional to the cardiac output, how much blood the heart is pumping, times a variable called the Ca. The Ca is going to be the O2 content in the arterial blood. So O2 content in arteries. All right, and then minus the cardiac output times the CV, which, as we saw with Ca, CV is the O2 content in mixed venous blood. And the mixed is important, and we'll get into why. Mixed venous blood. And why does this conceptually make sense, right? So the amount of oxygen your body consumes is going to be the difference between the amount of oxygen in the arteries and the amount of oxygen in the veins, right? Because the arteries travel through the body and deliver blood, and then the blood goes through capillaries into veins, and the veins return that blood to the heart. So the amount of oxygen that your tissues utilize is going to be proportional to the amount of oxygen that those tissues take out of the arteries before that blood goes back into the veins. Hopefully that makes sense. Let us know in the comments if there's questions on that. Some simple math here then would, tell us that if we rearrange this equation, cardiac output equals oxygen consumption divided by oxygen content in the arteries minus oxygen content in the veins, right? That's just, derivations of equations, math. Am I right? Okay, so now let's talk about each variable. Well, oxygen consumption, we actually can use somewhat of a constant for, because studies, have shown that the average person consumes 125 milliliters of oxygen every minute, depending on their body surface area. So we sub in this 125 milliliters of oxygen per minute times body surface area to the top numerator for oxygen consumption. Body surface area is calculated just using height and weight. All right. And then we did make the caveat, that if you're greater than 70 years old, you have to use 110. So I'm just going to put that above this, 110 milliliters of oxygen per minute rather than 125, because when you're older you consume less oxygen. Okay, then we have this Ca, Cv, and all that type of thing. How did we get from oxygen content in the arteries minus oxygen content in the veins to this equation, SaO2 minus, I forgot a parenthesis here, minus SvO2 times hemoglobin times 13.4? Well, the way we got here is important, right? So the amount of oxygen in the arteries and the veins, we could look at this equation and actually write it out like this. SaO2 times hemoglobin, right, times 13.4 minus SvO2 times hemoglobin times 13.4, right? And that would be equivalent to that equation. So why are we doing this? This equals the oxygen content in the arteries, whereas this equals the oxygen content in the veins, because we need to look at both the amount of dissolved oxygen, which is the SaO2, right? So this is the amount of dissolved oxygen in the blood, in the arteries. This is the amount of dissolved oxygen in the veins. But then we also have to look at the amount of oxygen attached to hemoglobin molecules, right? And that's where we need the amount of hemoglobin. And we know that, so hemoglobin is measured in grams of hemoglobin per deciliter of blood. And this constant here, this 13.4, is actually because there's 1.34, oops, sorry, my pen got a little crazy there. 1.34 grams, or each gram of hemoglobin has 1.34 milliliters of oxygen. So this 13.4 is just moving this decimal over 1 to make milliliters deciliters, And then that is how much oxygen is on each gram of hemoglobin, which is why you multiply the grams of hemoglobin times the amount of oxygen on each hemoglobin to get then the amount of oxygen attached to hemoglobin. So then what you're really getting here, right, is the amount of oxygen on hemoglobin times that amount of oxygen dissolved in the blood. And the same thing over here, right? It's equivalent. Hemoglobin 13.4, so the amount of dissolved oxygen in the veins, and then with the amount of oxygen on hemoglobin. Okay? And you're subtracting those because you want the difference between the amount of oxygen in the arteries and the amount of oxygen in the veins, because that is, proportional with cardiac output to the amount of oxygen consumption. So, when we get the final equation, how do we get it? The variables we need, right, are several. We need a patient's, so let's just write here, variables we need to acquire. We need a patient's height, which is easy, we measure them. We need a patient's weight, which is easy, we weigh them. In addition to that, we obviously know our variable, so that's the top of the equation. Body surface area, which is height and weight, times this constant. We also need an SaO2, which we get from an arterial blood gas. You can get it from an arterial line or an ABG poking the artery, but we need a sample of the arterial blood to get these dissolved oxygen in that arterial blood. In addition to that, we need an SvO2. This we need to get from a central line in the cavo-atrial junction. So what are we talking about here? And this is where mixed comes in. So the amount of oxygen in the veins is very much regional, right? If I sample the amount of oxygen in the veins in my finger, that might be different than if I sample it in my legs, which might be different than if I sample it in my head, because all those tissues are taking out different amounts of oxygen from the arteries. So what we want is a mixed venous. We want a sum of all the, oxygen that was taken out in the body, which is why we need a central line, because if we think about our heart, right? I'm just going to try to draw a heart quick. We'll see how this goes. That'll just have to do. We have, right, our inferior vena cava going up into the right atrium and our superior vena cava going up into the right atrium. In a perfect world, we would be able to get our sample of mixed venous blood from the pulmonary artery, right, going out of the right ventricle to the lungs, because that's true mixed venous. But so you can do that if you have a swan, but usually you don't. And in that case, you have a central line that sits right here in the superior vena cava at the cavo-atrial junction. And that is a fair surrogate of the mixed venous blood. So you need a mixed venous blood from a central line to get a true mixed venous, rather than just poking their finger or somewhere else, because all those will just show you the regional amount of oxygen in the vein rather than kind of a look at the whole body venous oxygen content. Okay, so you need an ABG, a central line, height, weight. What else do we need? Well, then we need a hemoglobin. We need to send a complete blood count, or I guess an H&H just for hemoglobin and hematocrit. So we do need that lab value as well, a hemoglobin. And these are the components that we need to calculate cardiac output. And all these things are achievable in the clinical setting, and often in a lot of cardiac intensive care units, my institution included, the nurses actually will have a protocol where they can draw all these things, and then they will plug them in, and the computer will kick out a Fick by itself, and then it'll populate it in the chart. So you can trend Ficks to see how that cardiac output and cardiac index is doing, depending on how you're modulating things, changing afterload, changing preload, contractility, etc., etc. All right, so that is how you derive cardiac output using the Fick equation. That's why we do it this way, and those are the components that you need. I hope that's helpful. Let us know what thoughts, comments, questions you have down below. Feel free to hit that subscribe button if you feel inclined. Check out some additional videos, and we hope to see you all next time.